My name is Eric Gonzalez, and I am the Assistant Executive Director for the Trust Fund. Our Executive Director is unavailable to be here today, and we hope that you will enjoy today's presentation. As a reminder, next Thursday, is our last webinar for April. It will be at 11 a.m. on Thursday, just like this one. You can go to our website, octf.ohio.gov, to register. The link will also be provided in the chat momentarily. For anyone that couldn't join us previously, we are informing everyone that this is our 40th anniversary, 40th year in existence. So we are excited to celebrate that by launching the Ensure They Shine April Child Abuse and Neglect Prevention Awareness Month. That campaign you will get a lot more information on in the coming weeks and is available on our website as well. Just a couple of housekeeping items. We do ask that everyone remain muted throughout the presentation. There will be time toward the end for questions. The presentation, as you have been notified, is being recorded and will be uploaded onto our website following this presentation that you can share with anyone that was not here or revisit if you would like. If you do need a certificate of attendance, please indicate so via the chat. Include your full name and email address, and one of our team members will provide that to you after the presentation. Okay, now we're going to introduce our presenter, Lori Robson of East Central Ohio Educational Service Center, and co-presenters Nicole Caldwell, who's the Executive Director of Guernsey County Children's Services, and Marcia Murphy, the Curriculum and Federal Programs Consultant, and Casey McVicker, the Prevention Consultant and McKinney-Bento Service Coordinator of East Central Ohio Educational Service Center. A little background on Lori. Lori is currently serving in her 7th year as Executive Director of Educational Services with the ECOESC. For anyone who loves an acronym, there's a good one for you. With over 28 years of experience in education, Lori has served in various roles, including classroom teacher, building administrator, district administrator, and her current position as Executive Director. Lori and her team are dedicated to continuing to grow numerous community partnerships across the 6 counties served by the ECOESC to enhance the educational and support services for children and families in the region. We're excited to have Lori and her team share with us more information on the partnership between Guernsey County Children's Services community partners and the East Central Ohio Educational Service Center. So with that, I will turn it over to Lori. Thank you.
Thank you so much, Eric. Our team, we are thrilled to be here and be able to highlight the work that is being done in Guernsey County to serve families and children in Guernsey County. We always talk about that it takes a village, and I think what you're going to see as we proceed through this presentation, it takes a village of people, but it takes the right people to accomplish the work. And you're going to find and hear the people that we have involved with Marcy, Casey, and Nicole are people that have children at the heart of all that they do and are very passionate about what we do. So I'm very proud to be colleagues and partners with these ladies. So if we can take just a minute, I'd like to go ahead and give them the opportunity to introduce themselves as well and about their own experiences. So I'm going to turn it over to Marcy real quick.
Good morning, everyone. So as Eric shared, I do work in the Ed Services Department at the ESC. And for purposes of this presentation, I am the grant coordinator and also the care coordinator supervisor.
And Casey?
Hi, good morning. Thank you for having me. My name is Casey McVicker, and I have a strong background and experience in social work and education. I am also the prevention consultant for the work that we are doing here in Guernsey County. As you can see from my slide, I'm dedicated my career to supporting students and families and reaching their fullest potential. And my passion lies in creating a positive impact by providing guidance and resources to those in need. So thank you for having me today.
And Nicole.
Good morning, everyone. Thank you for inviting our team to share this exciting information with you. I'm Nicole Caldwell. I'm the Executive Director of Guernsey County Children's Services. I'm in my 13th year as Executive Director here and have in total over 23 years of child welfare experience, ranging from casework to screener to supervisor and now the director. So we are very excited to be here with you today and share this information.
Thank you all. Our the work that we have immersed ourselves in is, we call it Guernsey Cares, and it is coordinating access to resources, education, and services through the work that we do. There are multiple tiers to what we actually engage in the work with families and children, but overall, it's just encompasses that coordination component and education. We believe in empowerment of our families so that they can become self-sustaining as we proceed through the work. So I have to kick off with acknowledging how appreciative we are with the funding that we have been presented with through Ohio Children's Trust Fund, specifically through the Children's Bureau. So we want to acknowledge them as well, because this work would not be able to be accomplished without their financial support and also the oversight and ongoing support that we received from Ohio Children's Trust Fund. So first, I just wanted to start off with, what is an ESC? Some of you may already be engaged in partnerships with your local educational service center, but some of you may be unfamiliar with what the purpose of an educational service center really is. So I wanted to start there. Educational service centers across the state of Ohio, there is legislation in place that any school district that has less than 16,000 students is required by law to align themselves with their local educational service center. We used to be local county boards of education, but through legislation through the years that has transitioned. Districts now have the option to align with any ESC that they wish based on the services that can be provided. They can choose to have services from one ESC, but be a member, aligned member to another ESC. So it has grown. And through that, our ESCs, we have also began working more as partners instead of just being territorial and just aligned specifically to one county. What an ESC does for school districts, we provide grant opportunities, consortium opportunities. We employ some of the high demand positions for school districts, such as speech paths, school psychs, et cetera, curriculum directors. With us specifically, we have a lot of very small school districts that cannot afford to necessarily have one SLP serving their school district. So they may hire or work with us, contract with us. We employ the SLP or speech path, and then that person is divided across multiple districts and contracted to serve those districts. So it really is a collaborative and consortium opportunity that we provide for our districts and shared services across all of our districts. There are currently 51 ESCs across the state of Ohio that serve over 600 school districts. For us, East Central Ohio specifically, we serve currently 18 school districts across 6 counties. We also, within those 18 school districts, include 2 board of DDs, 2 career centers, and we actually also operate 11 alternative schools across even broader than 6 counties. And that dimension of our world continues to grow as well. Across the school districts, we have approximately 25,000 students, and our ESC employs around 600 employees total. Our vision, as you see there on the screen, is really about providing those shared services, strengthening and assisting school districts to enhance their own services. And our mission that we keep at heart every day within our operation is, we are really here to help schools help students. And we continue to keep that at the heart and the middle of everything that we do and every decision that we make within our ESC. So for that, when you hear that word collaborative, consortium, shared services, it really just aligns perfectly with this work of what we're doing. So I have to acknowledge our ongoing partners within the Guernsey Cares program. And of course, Guernsey County Children's Services, what is our primary partner here. This again would not have been accomplished without Nicole Caldwell, and you're going to hear more from her in just a minute about how that partnership developed. But also we have to acknowledge Bridges to Wellness. And you're going to hear their name as well, because Bridges to Wellness really is our key partner with the care coordination component of the work that we're doing under Guernsey Cares. A little bit about Guernsey County as well, if you're not familiar. There you see Guernsey County highlighted on the Ohio map. Guernsey County has a population of a little over 38,000 people. There are 3 school districts within the county, and those are all 3 aligned with our ESC. And so specifically with our care coordination, we are working and embedded within those school districts to receive referrals. Those 3 school districts include Cambridge City, East Guernsey Local Schools, and Rolling Hills Local Schools. And when you learn about the dynamics and population of the school districts, the economically disadvantaged percentages speaks volumes. Cambridge is currently sitting at 74.9% identified economically disadvantaged, East Guernsey at a little over 47%, and Rolling Hills at 85%. And economically disadvantaged youth are those kids that are receiving those free and reduced lunches within those school districts. And that also triggers a lot of funding throughout our title funds that school districts receive as well. And another key idea to keep in mind about Guernsey County, it sits right at the intersection of State Route 77 and 70. So those of you that have heard much about human trafficking and circumstances happening, drugs, passages, etc., this is a key component of that within Ohio because of the fact that the 2 major state intersects right there within Guernsey County as well. So on this map, also, I wanted to highlight our partners, again, with the Guernsey County Children's Services and also with Bridges to Wellness, but also the Ohio Children's Trust Fund, where we are seeking or receiving our funding through. So with that, I would like to turn it over to Nicole to share a little bit more about how our partnership was developed.
So how did we get here? So once the RFP was released for this grant, we took a deep dive into some of the data in our local community in looking at areas of strength and need. And we were pretty astounded by some of what we found. Also, along with this, we decided that we wanted to do something a little bit different than just the traditional prevention programs that we think of whenever you think about prevention. We've had multiple grants over the years where, we've offered some prevention classes, some parenting classes, some shake and baby prevention through our local hospital, but we really wanted to do something different and something creative within our own community. So in order to establish what those needs were, we did do a deep dive into the data and found that, the cycle of poverty is real in our community. 34% of children in Guernsey County fall below the poverty level. 44% of our county residents receive public health coverage. 16% are food insecure. 58% have a high school diploma or less, and only 14.2% have a bachelor's degree or higher. Per capita income is around $23,599, which is well below the state average of $31,293. There's also an issue when it comes to access to resources, especially as it applies to healthcare and mental health care. 40% of our local residents have admitted to traveling outside the county to access healthcare, especially access to licensed physicians. Right now, our average is 1 in 614, which is well below the state average of 1 in 185. And then access to licensed psychologists, which I found to be very, very astounding, is 1 in 13,293. And the state average is 1 in 3,620. So that is a major issue in our local community. Children in placement, we have seen a significant increase in the number of kiddos that come to our attention that require out-of-home placement. In 2021, 237 children were deemed unsafe in their own homes. 163 were able to be maintained with kin, and 73 entered agency custody. In comparison, in 2014, there were only 22 children that entered agency custody. In total, there were 156 children that entered agency custody in 2021, which was the highest number we have ever seen in Guernsey County, and I believe we exceeded those numbers last year. Substance abuse continues to be a huge problem in our community. As Lori kind of outlined, we are at a major hub, being the intersection of 2 major interstates. And the overdose deaths in our community have increased by 42% in the last 3 years. And this is just a slide to illustrate the numbers of cases that our agency has handled. This is data from 2022. You can see that we had 394 screened in reports in the categories that those are broke down into. And that number continues to grow. I believe last year that number was 511. So prevention is definitely something that is needed in our local community. So as I had stated before, when we decided to pursue this grant, I really wanted to pull together some like minds of people in the community that I have learned to trust, of other professionals who we've kind of grown up together over the years in our relationships and in serving children. So I wanted to hear from them what they believed were the issues that were affecting the children that they were serving. So we pulled together a meeting with, I believe, 6 or 7 individuals representing agencies from juvenile court, from our local school districts, from the Board of DD, mental health related agencies. And we really just brainstormed, what are the needs? What are the strengths of our community? And where are there barriers to these services for families? So we pulled that meeting together and we used that information to inform our grant proposal. This grant is a 4-year grant. It's $125,000 per year and $500,000 in total. And the project objectives are primary prevention, serving families with school-age children, pre-K through 18, addressing social determinants of health, and improving child and family well-being. So that led us to our proposal, which is kind of broken down into 3 silos. The first silo is the cross-sector implementation and planning team. We participate locally in our own team. The team that we had initially has morphed a little bit. We have some other providers that are involved with us that help us look at the data to determine services and barriers and needs. We also participate in the state team as well. So as part of our grant, we decided that we really wanted to serve families and meet all of their needs through an assessment, and then determining what those needs are through that assessment and refer them to the appropriate resources. So Casey had come to that initial meeting and she had learned about a program that we felt did just that, which is Bridges to Wellness. So through Bridges to Wellness, we help families become self-sufficient, addressing their social determinants of health, reducing disparities, and improving population health. Bridges to Wellness is keeping data that we can use to inform the later years of this grant. And it also helps us identify barriers and gaps in services for our community needs. The other part of this grant is we've decided to host some prevention, what we call prevention hubs. And that can be a little confusing to some folks. That word hub gets used interchangeably through our program. But our prevention hubs are really just free education and resources for families in areas such as parenting skills, nutrition, budgeting, access to housing and resources. Some of those issues that we identified from the onset when we had our initial meeting was just that sometimes families don't know what resources are available, how to access those resources, and who to turn to. So we wanted to establish a safe place where people could come, they could bring their children. We offer, childcare for those children. We offer food. We just really want to get them in the door and be able to provide them information that could in turn then prevent child abuse and neglect in their home. Also, we trained several people in our community. I think we have 3 on here, but I think it ended up being 4 people were trained in the Triple P parenting curriculum. And we're also offering some of that information during our parenting hubs, and then some one-on-one Triple P parenting as needed.
Okay, so how did we really kick off this work? How did we really start here locally in our community and bringing all of our local team members for our CSIPT team here in Guernsey County? We held our first team meeting in December of 2022, and pictured here are just some of those community partners that have committed to being a driving force with us for this work. Some of those local partners included the United Way, our school districts, mental health agencies, some of those original focus members back with Nicole when we really started talking about bringing this work and these services to Guernsey County. Ohio Means Jobs, Job and Family Services, and Juvenile Court, just to name a few. During that meeting in December, we administered a needs assessment, a local needs assessment to our team members that attended. We tried to engage future commitment to being part of this team and this work throughout the duration of this grant, and then kind of getting feedback from our local team members and service providers. What are some of those needs that you see from our families and our caregivers here in Guernsey County? And of course, always, if you've ever been to a local meeting here in Guernsey County, you will always hear the number one need in our rural community is transportation. And then you can see on this graph, life skills was highlighted as one of those top needs, and then also social skills as well. So just keep in mind that this also came from our professionals here in the community. These needs were from those local team members. We also surveyed those team members in that meeting. And as we roll out this work and I try to identify for our families, where is a centralized location? What are some areas in our community that you feel are well attended by our families, that would engage families, that would be just a good family-centered, safe environment to host these prevention sessions. And so unanimously, well, I shouldn't say unanimously, but the YMCA it topped them all. Here you can see some of those local CSIPT team members that have committed to coming to our meetings, and then also whether they are providing services at the hub, presentations, whether they're assisting with transportation, whether they're referring agents, and then those that are also just being a part of this future work. After we held our local CSIPT team, our initial meeting, we coordinated a family focus group with caregivers and parents here in our community to gauge their interest and their feedback about what they would like to see at these educational hubs, and also to determine, do you feel that the YMCA is a good location and a safe environment? And so this was just some of the identified needs that were presented to the family focus group. And then after gathering the feedback from them, they identified these supports and topics for presentations at the hub, which we broke down into 3 categories under crisis supports, parenting supports, and life supports. So you can see from the takeaway on the flip chart papers that those were what our family kind of identified that they would like more education on. So that led us to the why, not the why as in WHY, but literally the why. So after gathering all of that feedback and data and informed decision-making from multiple CSIPT meetings and the family focus groups and our support from our local providers, we coordinated our first educational hub sessions at the YMCA. Their administration and board were eager to support this work and have committed to allowing us to use that space. And in an effort to draw attention and engage interest, we had a banner created. We kept that up at the entrance of the Y with their consent. We sent home hub flyers with students prior to end of the school year, passed them out at summer programs hosted by school districts, stuffed them in the summer sack lunch program at the Salvation Army, put on social media, and provided them to local service providers throughout our county to display and have available in their lobbies and reception areas. So this was our initial hub flyer. At the first round of sessions, the hub flyer included a QR code for participants to register and participate. Reducing barriers to participation was always at the forefront of this planning process in our rural community. And as you saw from the previous slides, and like I mentioned earlier, transportation was always a definite need. So we were able to reach out and partner with the Salvation Army, who is also one of our CSIPT team members who committed to transporting families that needed this service to be able to participate in the hub sessions. We catered dinner from one of our local restaurants and offered gift card incentives for participation. Early intervention, Help Me Grow, and Head Start, all of which are members of our CSIPT team committed to providing the children's activities during sessions. And again, from the data from both our team meetings and our family focus groups, we were able to coordinate sessions leveraging presenters and providers from our local community service partners. As you can see from some of these session topics, included fair housing, Get Smart with Your Money, which is an interactive budgeting program provided by US Bank, How to Land Your Dream Job, which was hosted by our local Ohio Means Jobs, Prevalent Youth Drug Trends, which was provided by our Sheriff's Department. And then a big takeaway was from our family's focus group, and one of the topics that they would really had liked to know more about was, the child welfare process. They really wanted to know more about discipline and what is acceptable because, of course, in their family focus group, they mentioned, well, back in the day, we were allowed to, beat our children's butts. And so they just wanted to know those changes and what is acceptable and what's not by discipline. Our last session was slated to be building resiliency and how to de-escalate violent and crisis situations with our presenter from Seeds of Hope, who was also a mobile response stabilization service or MRSS provider. So we were super excited about these sessions. Working with our ESC communications coordinator, we developed this wonderful flyer, couldn't wait to launch these sessions, and we're super excited about it. So what did we learn from these sessions? Well, we learned that we needed to regroup and reconvene the work with our CSIPT team and family focus group, as those sessions were not really successful and we had very low participation rates initially. Due to lack of registration, we did have to cancel some of the sessions. So after collaborating with our teams, we rebranded, we reorganized, we relaunched, and our education sessions at Feast and Find Out. So these sessions began in October of 2023. They were driven from parent voice and participants at these sessions. We encouraged registration, but this time we did not require it. So drop-ins were welcome. We changed the times that these sessions were hosted and facilitated them during the day as opposed to our initial sessions, which were from 5 to 6 in the evening. Transportation continued to be offered by the Salvation Army. Children's activities and childcare continued to be provided by our earlier intervention and Help Me Grow CSIPT team partners. And we also added an additional library when they heard about the work that we were doing. An additional partner, our local library, who wanted to come and help with the children's activities as well. We leveraged our PPP trained facilitators at this time to help present on topics. And as engagement has increased, we've been able to offer those caregivers who want additional support that one-on-one coaching, like Nicole had mentioned earlier. We continue to run these sessions until May of 2024. To date, we've had 143 participants, many that continue to attend on a consistent basis. And we do offer through our local OSU Extension office a brief My Plate presentation at the beginning of each session during our lunchtime. So along with the incentive cards at our Feast and Find Out, we are providing now take-home family engagement and children's activities each session. We have encouraged and help our participants to provide us with their favorite recipe, which we have incorporated into these take-home activities. So if you can see in the bottom left-hand side of your slide, those are My Plate menu recipes that our participants have filled out, and we have turned around and turned them into provided all of the materials and ingredients needed for that take-home recipe. We've really observed that this it infuses value and worth into these sessions for our participant and helps them to make them feel like they are driving these sessions and these activities. And that's really what we want. We want our caregivers to feel that they're getting what they need from participating in our sessions. So as you can see from these slides, we really try to tailor these activities to around our holidays. You'll see the upcoming holidays, you'll see the pumpkin activities here. And of course, because we're an ESC, we always try to infuse literacy into each of those activities for the children as well. Here you'll see some of the activities that are early intervention, right? You'll see the one with the heart Early intervention provided a Valentine's Day activity for our February session, and just some of our CSIPT team members that are engaging with the youth here in our children's activities at our local Y. Another component of Feast and Find Out that we infused this session is that to really address some transportation barriers and to increase accessibility, we have created mobile hubs. We have already hosted one of those back in November, and we have another one coming up, as you can see from this flyer, on May 8th, scheduled for this year. The mobile hub includes local resources on employment, parenting, healthcare, social and emotional wellness. And we have tangible resources provided by our local agencies and CSIPT team members at our mobile hub sites. We are really trying to take this into our community, take it into our local apartment communities where we know we have lots of children, lots of families there, so that there's just really no barriers to participation. One of our local factories, Carry Ingredients, you can see down there in the bottom left-hand corner, heard that we were doing this, called, said, hey, we want to be a part of this. We have job openings. We see your advertising. We have any families that need employment. We're hiring. So we invited them to come and participate with us and set up a table. And so we had all of their job descriptions there for any families or caregivers that were looking for employment. So this future upcoming hub in May also includes local additional staffing agencies. They heard that Carrie was invited and we're allowed to attend. So I've had 2 other local staffing agencies call and ask, say, hey, we're hiring too. Local mental health agencies have called and said, can we set up a table and be a part of this work? Absolutely. Come on. We would love to have you. So our mobile hub also includes children's activities with Giant Jenga, Connect 4. We set a pop-up tent, bring our grills, feed them. And we'll get into this a little bit later in the presentation, but our care coordinators are also present so that we can just start building that trusting relationships. Our families in our community will see us. We get out there, they get to know us so that if they do in the future, if they don't have any present needs, if they do in the future, they feel comfortable with reaching out to us and asking us for help.
Get myself unmuted. So meet our 3 community care coordinators, dubbed CCCs. Another pillar of this grant is to build a transformative and sustainable community-based care coordination network through this care coordination. And these ladies work together to serve the entire county. However, an effort has been made to streamline communication and not wanting to duplicate referrals and also to foster trust and strong relationship. We have attached or aligned each one of our care coordinators with one of the districts. And you can see the logos there on the slide by their portraits to see which district they were aligned with. So community care coordinators were truly the reason that this model was originally designed. Our CCs are uniquely able to engage those who are at risk for poor health and social outcomes. And this model provides training and tools for them to identify risk factors and also to work towards eliminating those risks one by one. They track the risk factors from identification all the way through mitigation, and then payment is linked directly to pathway closures. So their primary responsibility is to serve as partners and coaches, connecting clients to things like health insurance, primary care provider, medical services, to educate about their conditions, and then to provide referrals to community resources. Also making sure to ensure that basic needs are met and assist with communication between the agencies and providers. And then to act as communication carriers, if you will, but to spread the word, to increase the awareness about care coordination services throughout the county and in our schools, and through visits and flyers and conversations with all the stakeholders. So our focus population with our work and through care coordination is students in grades PK through 12 and their families. And our goal is to identify barriers that are affecting their success in school, and also for that prevention of abuse and neglect. If the client's enrolled, care coordinators provide ongoing support and education to eliminate those barriers, and then empower those families to become independent and self-sufficient, and in most cases, truly givers of hope. So here are the 21 evidence-based pathways that can be used to support our clients and our care coordinators work through. But how does this all really work, right? So once a risk or behavior is identified, we encourage personnel from the agency or the school, first of all, to inform the client, to the parent or the guardian that's being referred, that they're making the referral. The referral submitted, care coordinators receive the referral, and they reach out to set up a time to meet with the client so they can determine if there is truly a need or a want for the support or service. And then if enrolled, they will provide ongoing education, generally 2 per visit, and they will support the client until risks and barriers are eliminated. And again, the pathways are closed. We always want to get to that end game, the finish line. So who can be referred? Basically, as you can see on the slide, you can read through there for a minute, but it's basically anyone that has causes for concern, right? Health, attendance, trauma, loss of a home. In many cases, those are the top things that we see with our school age students. So to summarize the community care coordination component real quickly, you can see here that we have employed 3 full-time coordinators to serve in the county. All 3 have earned their community health worker credential. Monthly visits include a component geared toward meeting the child or a family need that's been identified. Ongoing work includes removing barriers, completing steps toward the pathway completion. I would like to share that currently we only have 2 of our care coordinators working, as one is off on maternity leave. So between the 2 of them, they this month have 63 referrals and 54 actual enrolled participants in care coordination. But just truly, care coordination plays just a critical role in bringing and bridging that gap, bringing people together and bridging the gap between healthcare services and the community. And you can read the rest there, but really the presence of the expertise has been essential in promoting positive health outcomes here in the Guernsey County. Are there any questions from anyone? Raise of hand or in the chat.
You guys did a great
Quiet
job.
group today.
Yes.
I have a question. Do you interact with the Ohio Rise care coordinators in providing these services, and when might you make a referral to that service?
We actually do. Actually, Ohio Rise is part of our CSIPT team that has helped drive this work. And as a care coordinator, I am part of the Ohio Rise meetings.
Do you also work with your Family and Children First Council with any of the cases?
I am a member. We are our care coordinators are members of the Family and Children First Council, and we also we have a coordinated council. We also have representation on our United Way board. So we're just really infused, and that's really what we have, a wonderful community. We have a wonderful support, and our agencies in our community work really, really well together. We all recognize the need here in our community of our families and our children. So we are very fortunate in that aspect.
Thank you.
I think you brought up a really good point, Casey and Sylvia, that through this work, what we've been trying to do, even as an ESC, because there's resources and so many people working toward the same common goal for children and families. We've worked diligently to how do we break down those silos and align ourselves together so that we're working and supplementing and complementing the services that we could each provide. I think that's a huge piece that we've been trying to accomplish across all of our counties, but specifically seen it be immensely successful in Guernsey, because Casey's right. There are people and agencies that want to work together and realize their own capacities and limitations, and we're better together. So how do we proceed and move forward better as one?
Okay, great conversation. Again, thank you guys so much. And as a reminder, this will be posted on our website and can be accessed and shared to anyone that may be interested there.
Thank you again for the opportunity. We appreciate it.
Yes, thank you.
Thank you for having us.